Birth control and the effects on the human body. This is by Bailey Hernandez,
Tian'Te Simmons,
and Stephanie Amira.
Birth control relevancy. Birth control is a controversial topic throughout the world, and many people have different views on why or why not it should be used. Although there are many benefits to using birth control, there are also many negative side effects that it can cause on a human body. This is a prevalent issue that many people face around the world and a topic that should be discussed.
Different forms of birth control. There's the pill, the patch, Nexplanon, which is an implant in the arm, NuvaRing, which is an implant ring in the vagina, natural remedies, the IUD, which is also an implant in the vagina, condom, diaphragm, which is a female condom, Depo-Provera, which is a shot, and spermicide.
The effectivity of birth control methods. No natural remedies or herbs are 100% effective. The birth control pill. Perfect use, 99% effective. Typical use, 91% effective.
Birth control patch. Perfect use, 99% effective. Typical use, 91% effective.
Arm implant, which is Nexplanon. Perfect use, more than 99% effective.
Vaginal ring implant, the NuvaRing. Perfect use, 99% effective. Typical use, 91% effective.
IUD. Perfect use, more than 99% effective.
Condom. Perfect use, 98% effective. Typical use, 82% effective.
The diaphragm. Perfect use, 95% effective. Typical use, 79% effective.
Depo-Provera shot. Perfect use, 99% effective. Typical use, 94% effective.
Spermicide. Perfect use, 92 to 96% effective. Typical use, 71 to 88% effective.
Family planning. Perfect use, up to 99% effective. Typical use, 76% effective.
Pros and cons. We will first discuss the pros. Reduces the chance of pregnancy. Reduces menstrual flow and relief from pain associated with heavy periods. Assists in regulating conditions such as PCOS, endometriosis, and anemia. Reduces PMS, which is premenstrual syndrome. Now we'll discuss cons. Can form cancerous cells such as ovarian and breast cancers. Can cause excessive acne and hormonal imbalance. Possibly reduces acne in individuals if they are already suffering with acne. Use not recommended if there are pre-existing medical conditions that can interfere. Can cause blood clots and or thickening of blood.
Alternatives to birth control. There's the pull-out method, tubal ligation, natural family planning, basal body temperature, male vasectomy, abstinence, cervical mucus method, and the calendar method.
Now we are going to talk about the different methods, the effectiveness, the advantages, and the disadvantages. The vaginal ring. It is 92% effective. Advantages. Easy to use and can be worn for 3 weeks. Affects fertility 1 month at a time. Disadvantages. Increased risk of heart attack and stroke. Possibility of expulsion from the body.
The pill, 92 through 97% effectiveness. Advantages: makes menstrual flow lighter and very effective if used correctly, decreases cramps and acne. Disadvantages: must be taken every day at the same time and cannot be used by individuals with certain medicine. Can occasionally cause side effects, nausea, increased appetite, and blood clots.
The IUD. It's 99.9% effective. The advantages are: it can be inserted into body, may reduce period cramps, and can make periods lighter. Can be used while breastfeeding and used for an extending period of time. Ability to become pregnant returns quickly once removed. The disadvantages: large cost and can cause hormonal side effects such as breast tenderness and mood swings and headaches.
The Depo-Provera shot. 99.7% effective. Advantages: convenient, one injection prevents pregnancy from 11 to 13 weeks. Birth control effects begin immediately and are reversible. Can be used while breastfeeding. Disadvantages: can cause adverse effects such as irregular bleeding, dizziness, weakness, decreased libido, and ovulation may not occur after a year.
Arm implant, 99.9% effective. Advantages: do not have to take every day, no estrogen-related side effects, last up to 3 years. Disadvantages: insertion may be uncomfortable and has progesterone side effects and have a large initial cost.
The female condom. It's 79% effective. The advantages are female control advantages. More comfortable than male condoms. Can be inserted before sex and is stronger than latex and prevents STI. The disadvantages: can slip easily into vagina and anal during intercourse. Difficulty in removal and sometimes insertion. Not readily available in drugstores. Higher cost than male condoms.
The male condom, 84% effective. Advantages: widely available over the counter, easy to carry, and actively involves the male partner in contraception, prevents STIs. Disadvantages: may break in use, especially if used improperly.
Spermicide, 60 through 80% effectiveness. Advantages: very few side effects and is reusable and relatively inexpensive. Disadvantages: requires constant use, should be left in place after 8 hours of intercourse, can cause shock syndrome, and may cause allergic reaction.
Pulling out method. It is 78% effective. The advantages are it's free, can be used in combinations with other birth control methods. The disadvantages are may not withdraw in time, pre-ejaculation can have viable sperm, very ineffective in pregnancy prevention.
The patch. It is 92% effective. Advantages: easy to use and small, stays on well and must be replaced weekly. The disadvantages: possible skin reaction.
Statistics: about 41.9% of females who get sterilized have no higher education or a high school diploma. The pill is a more popular method for women with higher education.
Contraceptive method statistics. Women are more likely to use some form of birth control than none at all. More women are likely to go through sterilization than men. The oral contraceptive pill is the second most popular form of birth control.